Today I'm going to inform you on multiple sclerosis, the symptoms, the diagnosis, the treatments, and the patients that normally get it. Uh, my family has been affected by multiple sclerosis because my grandfather has had it since 26. So I have watched him deteriorate since I was very young, and it made me want to research more about it. So I have a little bit of information that I'd like to share with you. Multiple sclerosis deteriorates your nerve endings, which makes it hard for your brain to send signals to like the nerves in your hands so that you can do movements. So that causes loss in like feeling, like numbness. Sometimes you can lose your sight because nerve endings in your eyes. Sometimes you can lose like feeling of your mouth, so your speech is slurred, and you can also like get bladder infections and like have to use like stuff to help you go to the bathroom because you can't physically do it yourself. These symptoms become worse and worse, and sometimes you relapse. Like you won't feel it for a while, and then it'll come back out of nowhere, and that's when it's a problem because you have to go to the hospital. If you fall and you can't actually move, you lose all feeling. Currently, there's no test. It currently requires you to rule out all conditions for other diseases to actually decide that this is the disease that you have. And the way that they do it is they do it through blood and using blood to actually see like if you have a blood problem, like if you have other disease in your blood. And then also they'll do a spinal tap, which can tell if you have built up antibodies to the disease. You can also do an MRI to detect lesions in your brain because when MS attacks, it's your immune system attacking itself. So it actually attacks parts of your brain, so it makes it very hard for you to make cognitive decisions. Currently, there's no actual treatment for the disease. Like you can't actually cure it, but you can make it so that it doesn't affect someone as much by using steroids to actually like lessen nerve inflammation. You can also do a plasma exchange where they mix your blood with a protein so that you're stronger, or you can also do physical therapy to help strengthen those muscles that you have that are getting weak because of the nerve. They also use beta interferons that are injected under the skin so that you don't have relapses that are so bad, because sometimes when you relapse you just can't even move at all. You lose all sense of motion, and it can either be in like one part of the body, normally it's half of the body, or in the legs. You don't usually go completely motionless, but sometimes you can. MS can affect children, but because it's a deteriorating disease, it doesn't actually like show the symptoms as much. So normally people get diagnosed between the age of 20 and 50, and women get diagnosed at twice as much as men. And if you're Caucasian, you have a higher chance of actually contracting the disease. The disease also doesn't show a genetic pattern, like it doesn't pass down generations, but there is a chance. So if you have someone with MS, you might have the possibility of contracting MS. Luckily, we have gotten better with MS. Currently, there's a lot of money invested into coming up with a cure or something that will actually help these patients, and I'm very thankful for that. So I want to also give a shout out to the MS Foundation for raising money and awareness. And if you're interested in MS, please check their website out. So I talked about the MS today. If you're interested, make sure you check out that website, as well as if you want to, you can donate to the foundation. That would be much appreciated by me and my family.